Good morning, everyone, and welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University, and I also have the great privilege of being the inaugural director of the Clark Fox Policy Institute. The Clark Fox Policy Institute is dedicated to the development and implementation of evidence-based policies that improve the lives of kids and their caretakers. Which is why we're so focused on today's event. And today's panel discussion, early childhood education and COVID-19, the impacts, the immediate and long-term impacts. First, I just want to recognize that these are highly unusual and unprecedented days, that they're very stressful for many people, both in terms of your health and your finances. And I just want to wish you all good health and safety, and know that we will pull through this together. And I'm confident that we will be stronger as a society as a result. So we just need to just stay strong. Today we have a really incredible panel. We have, let's see if I can advance this. I'm having trouble advancing. There we go. These are our panelists. We have Katie Kaufmann, who's the director of Ready by 21, Ellicia Lanier, who's the executive director of Urban Sprouts, Gloria Nolan, who's the campaign coordinator for Ready by 5, Joey Saunders, director of policy over at WEPOWER. And then we also have, and you heard her voice earlier, Tia Thurman, who's the associate director of the Clark Fox Policy Institute. She will be monitoring the questions and your comments within the chat box and relaying them to us. And we also have Tiffany Phillips, who's a member of the Brown School's communications team, who's just helping us with some of the back-end support and also ensuring that supporting Atia and looking through some of those comments. So what I thought we would do for today's program is first just take a look at a new report that has been issued by the Clark Fox Policy Institute, which called Launching Lifelong Success, Ensuring St. Louis Kids Are Ready by 5. This report basically gathers the research behind all of the incredible positive outcomes that are associated to quality, affordable early childhood care and education. I'll briefly go through this report, and then once we have a foundation of knowledge on why access to ECE is so important, I want us to hear from Ellicia and Katie, who are going to talk about what's happening within the early child education and care system currently as a result of COVID-19. And then as we start to understand what's happening now, and we talk through some of the kind of immediate responses that are needed, we'll transition to taking a more kind of long-term strategic look, saying like, we know that the early childhood education system was already fragile, and COVID-19 has made it even more so. So what type of thinking, both long-term strategies and public policies, do we need to push forward that are going to strengthen the system, make it a more equitable system, and really ensure that both kids have everything they need for the social emotional development and parents have everything they need to be able to re-engage in the workforce, knowing that their kids are, their safety and well-being is being attended to. So with that, I want to just go through some of the amazing benefits. Again, this is all in the Clark Fox Policy Institute's report, and maybe either Atia or Tiffany could just put a link to the report in the chat box for those of you who are interested in going through it. First, there's an incredible amount of educational benefits. What the research has shown is that children who have access to high quality ECE have higher high school graduation rates. They have better four-year college attendance rates. There is an early detection when it comes to special needs, and there is a narrowing of the achievement gap. Additionally, there are incredible health outcomes that are associated with this as well. There are lower rates of diabetes and high cholesterol, lower rates of substance abuse over a lifetime, a higher likelihood of having health insurance, and decreases in teen pregnancy. And additionally, when we take a look at the outcomes that have been documented in terms of economic prosperity and community vitality, we see that there's greater maternal workforce participation. There's an increased likelihood of having skilled jobs later in life. There's higher employment rates as adults, and there are lower crime and incarceration rates. And all of this is because when kids are in a quality setting that is attending to their early childhood care and education, it allows for early detection of health issues, of developmental issues, and those issues can be addressed and remedied at 0 to 5 when it's most important to kind of address and remedy those issues. And by doing that, you are setting up a child for lifelong success. So I want to talk about why this is so important for St. Louis. The children in St. Louis do not begin life on an even playing field. It's been very well documented by Forward Through Ferguson and the Ferguson Commission's report, through great organizations like Health Equity Works and Homegrown STL, that there are incredible racial disparities when it comes to having access to quality early childhood education and care. Additionally, it's families who are living in poverty face these same barriers in getting access to this. And it undermines the financial stability of the family, and it further fuels this intergenerational wealth gap. Look at that kid, he's skyrocketing to success. So the report makes 3 recommendations, and I too want to just take a moment to say that this report was inspired by so many other reports that had come before it. And I just want to take a moment to recognize Kirby Buckholder at IFF and their reports, the first steps to equity. And I also will get a great chance to hear about the playbook from Joy Saunders, which really maps out how we get to a stronger, more equitable ECE system. The 3 recommendations that this report makes is that we need to increase access through an investment both through public dollars and private dollars in early childhood education. And Gloria Nolan from Ready by 5 is going to talk to us about some of the activities that are happening related to that. Also, we need to ensure that the prioritization of allocation of new or existing ECE funding goes to the kids who have the highest need, those who are most impacted by poverty, which we know disproportionately tends to be Black and brown families. And that was greatly documented in the IFF report that I mentioned earlier that Kirby Buckholder and others did such a beautiful job on. And then finally, we need to increase quality through a coordinated ECE system supported by a single entity. And there are organizations that are looking at this right now that will be seeding this. And it will be a regional coordination and administration of early childhood education and care that takes a look at things like quality improvement, professional development for providers, and increased pay rates for those providers, so that there's less turnover within these organizations. So with that, just as an overview, and again, you can dive into the details of that report at the Clark Fox Policy Institute's website. Now I want to kind of turn it over to our panelists. And first, I would love to hear from Ellicia Lanier, who is the Executive Director over at Urban Sprouts. Ellicia, can you tell us what is happening to early childhood care and education providers right now as a result of COVID-19?
Good morning, everyone, and thank you so much, Gary, for hosting us today. I think this is a critical conversation and is really timely because early childhood centers right now are on the front lines, right? They're caring for the children of essential workers. They are challenged with the complexities of how to care for families for families while they're at home. And we are starting to see just how fragile the system is during this crisis, even the more. And as you sort of laid out in the report, we know that early care and education is essential to our society as well as our economy, but without the right investments and supports from the local government, state and federal government, the system and its fragilities have sort of exposed the early childhood providers in a way that's made them really vulnerable. We're seeing providers struggle with how to get PPE to sustain their operations. We're seeing providers forced to choose between should we pay our employees or should we close, having a lot of those unanswered questions from government around how do we practice social distancing in a space that is infused with little ones who don't really understand the importance of being away from each other. And so to even do that within a child care center raises a high level of complexity and almost impossibility for some due to the size of their space, their staff, and their capacity. So right now the system is in shock and in need of much thought and long-term considerations on how we look at what is necessary to sustain the system in the future in the event of a crisis such as COVID-19.
Yeah. And so, Ellicia, you know, we often think of providers as the big centers, but there are also, there's like a fabric of providers that range from the centers to religious-based organizations to smaller family-based and community-based. Can you share a little bit about what's happening to the smaller providers? Do you think they're going to be able to survive this?
Gary, my hope is that yes, but research has shown, and there's a lot of right now papers and op-eds that kind of tell us different because the economy is shaken, been shaken so abruptly. A lot of those smaller centers and homes have been forced to either close or go without pay. For instance, a person who's operating a center out of their home, maybe just doing work that as a sole proprietor. And so opportunities like the PPP loans may not have been available to them due to not having an active W-2 payroll system. Resources are sparse, across how to get wipes and gloves and how hard is it to get tissue and paper towels now, and you're operating in a small center that doesn't have a supply chain to lean on. And so yes, those smaller centers and family homes and religious organizations are even the more stressed because of their positioning. And I think that is something that we need to consider as we start to shape the early childhood system, is that not only are we looking at those most marginalized families, but what about the providers that sit in those zip codes that already lacked adequate resources to provide for their children at a quality rate?
Yeah. So now we know that there are folks who are on the front lines of this pandemic, the first responders, the folks who are working at hospitals. But we also know that there are low-wage earners who have no choice but to be on the front lines of this, whether they be at gas stations or grocery stores or other places. Do you know how are they providing for their kids, and what kind of stress are these parents experiencing during this?
I think we're looking into a lot of trauma. One of the things that our team of folks are kind of thinking about is what are the long-term impacts of something like this? I mean, families are already stressed and burdened by caring for their young, and now we're seeing that families are having to do that from home with very little resources. I think Additionally, I'd like to lift up that it's communities are being hit really hard. Black and brown communities are being hit really hard with COVID-19. And as we look at the amount of essential workers that are in those zip codes, we're starting to see this virus be spread at an exponential rate, and also take the lives of many Black and brown persons. And I think, that is really telling as to who this is really going to affect, right? So the essential workers and the folks that are still moving about and don't have the opportunity to stay at home are the ones that are going to experience probably the most trauma from this pandemic. It's really hard to watch the news as an African-American woman and look at the death rate. I think we had 10 people pass away yesterday, and 9 of them were African-American. That says a lot about the age and the health of the community that is at risk at this time.
Yeah. Thank you, Ellicia. It is incredibly stressful for providers and parents, and we have a lot that we need to do and to respond to. And with that, I want to shift a little bit to Katie Kaufmann, who's part of the regional response team that's being led by Jason Purnell. Katie, can you tell us a little bit about what's happening in terms of response and the type of thinking that's going on?
Absolutely. Thanks for having me today, Gary, and for letting me also bring my 6-month-old into the conversation too. I'm even more grateful for the early childhood educators who normally would be caring for my children when I'm doing my day job. So it's been my pleasure to be involved with the regional response team for the last couple of weeks. I think many folks will know Jason Purnell and the work that he has done out of the Brown School at Washington University, focused on health disparities for many years. And obviously, Jason has been called into service by our county executive and has really taken that charge fully to heart, and is working to provide some coordination and some amplification of the disparities through this regional response team, which is working across 3 counties in Missouri, St. Louis City, St. Louis County, St. Charles County, and into 2 counties in Illinois, St. Clair and Madison counties. So that group originally formed some of the regular task force kind of topic areas that I think we're all accustomed to. And so originally identified children and education as being a space that we knew would be severely impacted by the stay-at-home orders and just the slowing down of the economy and the normal ways of doing business in our world. But we've pretty quickly recognized that we can silo things in that way in normal times, but really the issues across different demographics, whether it's aging adults, people with disabilities, or the homeless, are all very similar. Folks right now are struggling to have their basic needs met, especially folks who have limited access to transportation or limited access to social support systems. We also know that there's a lot to be figured out as far as logistics and technology and distribution chains across those various groups that we actually have a lot of expertise in this region through some of our corporate partners and players, but it's not necessarily something that our social service safety net has been able to leverage in the past. And so we are now working across K-12 education and with early childhood education providers, primarily to look at how do we stop the spread and slow the spread in communities that are both medically and socially vulnerable. And so in the early childhood space, this has meant being advocates for prioritizing the individuals who are continuing to do care, whether it is in the settings that they were doing care in or providing care through driving around to the homes of the families that they serve, prioritizing those folks for PPE, making sure those folks have access to the supplies as well as the knowledge to use that equipment correctly and safely for their own safety and for the safety of the families that they work with. I think we're also recognizing that many kids get fed at school, whether it's the school that they go to when they're under 5 years old or whether they're between kindergarten and senior year. So thinking about how do we ensure that kids are being fed, having access to food, having access to formula, having access to diapers, all of those supply chains are being figured out right now. And the regional response team is trying to be supportive to the existing networks that are there through the pantries and through the Salvation Army and Catholic Charities and other big organizations, but also through some of the small grassroots networks that groups like WEPOWER and others are setting up and have set up in the past. I think the regional response team is also just trying to elevate the stories of the work that is happening because as we know, many essential workers are really invisible at this time. And that extends certainly to our early childhood educators. Folks are just expected to keep doing their job despite all of the other challenges that the stay-at-home orders and protecting your family and yourself bring into bear. So those are some of the pieces that the regional response team is working on right now. And I think we will hopefully soon be able to shift some of our thinking from immediate crisis to more long-term strategy. And I know, Gary, you mentioned before that we're going to get through this, but I hope that we're also going to get through this in a way that makes St. Louis smarter and stronger and more equitable. I think especially white folks need to really lean into some of the discomfort and some of the challenges that are being brought to our attention that we know that our Black and Brown friends and colleagues and neighbors have been experiencing for longer. Challenges with access to medical care, challenges with access to power structures and wealth, obviously are all things that are not new, but are being felt new by many folks who hopefully will not let go of this feeling, will not let go of this knowledge, and will push forward for change for moving forward. So the regional response team is beginning to move into that phase now of thinking about longer term strategy and recovery for our region long term.
Well, I know that everyone is so grateful to have such amazing minds and thinkers working on this and collaborating. So please relay our deep gratitude to the regional response team. So now I want to transition just a little bit to talk about, how do we, once we get past the crisis, and I am optimistic that we will do that and we will have a better understanding of the delicacy of our existing social systems, and we will really focus on strengthening them. That is really where we start to take a more kind of long-term strategic look. And so I want to hear from Joey, because WePower has done some incredible community engaged work to really understand what the system is currently, and hearing from multiple stakeholders, from providers to parents to community activists and others, on how we can strengthen the system and make it more equitable moving forward. Joey, can you tell us a little bit about that process first, and then some of the findings and outcomes?
Sure. I think like the really important thing to know is that this playbook that you were sort of referring to was built on a foundation of not just other reports like First Step to Equity from IFF, but also on the lived experiences and understanding of like a wide range of community members, everyone from center directors and superintendents of public school districts to parents who may have, I think, initially felt, why am I in this room or at this table, to understanding how important it is that they're sharing their stories about how difficult it can be to find care, particularly if you're eligible for a subsidy, for instance, and you're trying to find a quality school in your or early childhood care center or home-based provider that's either near where you live or where you work. Access to that is often something that sometimes doesn't exist, especially for communities of color and from lower socioeconomic status communities as well. But by bringing all of these voices together and engaging over 1,000 community members, we were able to produce this playbook that really delved into not just the research, but also these lived experiences and stories to sort of produce 17 like pretty distinct solutions for what we see as creating long-term systemic change in the early childhood education ecosystem. So basically, there was a community visioning session in partnership with Forward Through Ferguson that really focused on looking at this problem through a racial equity lens. And then for several months, these community members came and spoke with subject matter experts and engaged with research and just used their radical imaginations to really hone in on what were kind of incredibly innovative ideas, what were things that were just really obvious, and then really winnow down and come up with key solutions that we sort of synthesized and turned into what's now the playbook. That was basically the process. What was the second part of the question?
Well, could you tell us a little bit? So it's a playbook. So you brought these wonderful stakeholders together. You had these
Right.
committees that focused on each of these key areas. So how does this playbook map things out for us, Joey?
Sure. So basically, it starts off by admitting that systems change takes several years to actually happen. So we sort of have this action plan that could not have predicted what was going to happen in terms of a global pandemic. However, I think the pandemic really underlined exactly how important a lot of these solutions are and how much we wish that it would have been possible to have some of these things like a single entity that's really charged with systems coordination or local dedicated public funding for early childhood education. We know from looking at other communities that have already implemented similar solutions, which are highlighted in case studies throughout the playbook, that they're faring better during this epidemic because they had already taken these sorts of precautions and preparation without even knowing that such a pandemic could have happened. So making sure that we take solutions like these and then plot them out on kind of a strategic action plan, understanding that these aren't things where we can pick and choose what to do, but because the system is so interconnected, and SKIP is another partner model that does strategic, is kind of like a strategy tank. They've actually kind of mapped out a way to show you how all these different pieces of the system work together. So it's really not just about creating a bunch of seats to make sure that everybody has access, if you're not going to also focus on how we're even defining quality, because Missouri is one of these few states that doesn't have this broad definition of what quality is and doesn't have a way, aside from licensing and accreditation, to even necessarily say this center is meeting X quality and efficiency standards. So there's a lot of different moving pieces of the work, What we want to do is make sure that it's clear what all those different pieces are so that folks can track them and make sure we're keeping people accountable. And the other huge part about this work is that this action plan can't happen if people aren't willing to take action. And people can't take action if they don't have their, if there's no capacity building and no confidence in the people who have designed these solutions and in the people who are actually running the system or benefiting from the system or stand to benefit from the system anyway. So we want to make sure we're building parent and provider advocacy skills and advocacy skills for anybody who's willing to take the charge and really realize that early childhood providers aren't just first responders, they're first preventers. As you can see from all of the amazing report that you all are putting out, there are so many things from crime reduction to a more productive workforce to stronger K-12 system because of the academic benefits to health benefits because of being able to catch things earlier on, that this is such an integral infrastructural imperative right now to include and to invest in.
Yeah. So first, I just want to acknowledge we're having some issue with the chat feature. So there isn't currently a way for you to submit questions, but we're working on that on our back end. We have, T and Tiffany are doing what they can to see how we can ensure that you have an opportunity to engage in this conversation.
Thank you, Gary. And I just want to let people know, if you are in front of your computers and you have my email, because I think I sent everyone an email, that's how they're on the meeting, they can send those questions to me via email while we're having Zoom help us.
Okay. Thank you. And thanks to all of our participants for your grace as we figure out this new world and new technology. We are getting better at it every day, but there's always something new to learn. Joey, one of the pieces that's in the playbook that is also in the Launching Lifelong Success report is this desire to increase public funding. And that's where, Gloria Nolan has been doing some really wonderful work with Ready by 5. Gloria, do you want to talk a little bit about how this piece of the playbook has been put into action and, and what's happening with that?
Sure. So, of course, like Joey kind of pointed out, that there is an action plan that we have in place. There's a timeline, and with things the way that they are now, just some of those things are just kind of have been placed on pause. But that first, the first move in that would be to go after a modest sales tax increase. And so I'm working with community members and the fellows and all of the supporters that we have to really, we were getting started right before everything kind of kicked off. And so just in that phase of getting on the ballot. And so we needed to collect signatures, and we had a goal of about 45,000 signatures. And on March 7th, we actually went to the polls in the county and really engaged the community there and collected over 1,000 signatures. And so it was really a great day and a great kickoff. But with things the way that they are, because so much of it is in person, so much of it is with the people, engaging community, telling the stories, teaching people about what it is that has been the information that's been collected, just sharing that education. That's not something that can really happen right now. So we are working out strategies to just pivot a little bit and figure out how to use this technology and still connect with people. We were in the phase of starting up a power building academy, and that's to enhance those advocacy skills for members of the community, those parents, those providers, so that they can get involved in the process. They can learn about the process. And then a lot of people really have a lot of talent and skills that they already possess within them, those stories, those lived experiences. And so just kind of bringing those people together and harnessing all of those, all of that creativity and those skills, and then working together to really see this through. And so we're still working on it in terms of, you know, how can we do this digitally? How can we still gather those folks? And once things have settled a bit and we're able to kind of go back out with the people, we can still, you know, spread that message and definitely reach the people to move forward with the initiative as we planned. And so now it's just kind of gathering things up in the background, and a lot of people are ready and willing to engage, because we're seeing like those gaps that everybody kind of talked about earlier, and the importance of still making sure that we take care of our little ones so that they'll be ready by 5.
Yeah. So Gloria, the campaign is kind of in a holding pattern from what I understand, but it's the pursuit of increased public funding will continue regardless.
Yes, absolutely. Because it's a must, and we know that it has to be done. And so, like I said, that pivot, we want to, you know, go back to the drawing board and say, hey, you know, what can we do at this point? But not forgetting the fact that the providers on the front lines, they are, you know, they need some immediate care and help and support right now. And so we need to look to those and see how we can ramp up those strategies too.
Yes, thank you, Gloria. And I want to go back to Ellicia. Like, what would you say is what would be the most help right now to ECE providers? Like, what do you need?
I think so. There is an immediate thing that everybody on this call can do, and if Natia can assist us with this, I think that the first thing is that we would love for you to follow the work that is being done by Ready by 5. This is going to be to result in a long-term impact on the system. So we need folks to get on board, follow that, and help us to champion that body of work once it is off the ground again, because it will take public investment for early childhood to be equitable, accessible, and strong for our region. So if we could share how folks can get involved in that, I think that would be the greatest splash in the pond from the 125 people that we sit shoulder to shoulder with today. Yeah. The second thing is I would say that early childhood centers need resources. So our resources come from parents paying tuition and state subsidies and dollars that flow through the government. And as the government is still figuring out how to work those things out, there's still sort of some of that gap. And so we are considering how to get financial resources to centers to buy PPE, paper towels, and things of that nature. So I think that is one of the things that we are trying to champion for small centers, and get access to healthcare and testing, right? Get folks tested and get families PPE as they go out into grocery stores and things of that nature, so we can stop and slow the spread. So if folks want to get involved in that way, I know that Katie can probably, I'm just putting you on the spot, but maybe Katie can kind of help direct how to get in touch with our early childhood sort of ad hoc committee of the regional response team. And then if you know early childhood provider, reach out and see what their needs are directly, even if it's the teacher of your child, if it's your next door neighbor, if it's a center that you are close to or that you know of. I think that sometimes a conversation can lead to who you know, what you know, and how to get it. And those sort of grassroots efforts seem to be what is helping us to build muscle as we think about the larger, broader system.
Thank you. Thank you. And Katie, do you want to chime in?
Sure. My
Inflexible too.
with my my teething baby in the foreground here. But yeah, I mean, one of the, I mean, Alicia's point, and I think the question that was asked earlier, I think many of us think about the nonprofit organizations and the school districts. My 4-year-old's also telling me I'm too loud right now. So okay, sweetie. The for-profit businesses really need support, and primarily those businesses are small. United for Children is launching this week a grant application that is open to any early childhood provider to apply for, and to receive a mini grant to support their operations during this challenging time when we know many centers are not able to access the PPP loans or other small business supports, as Ellicia mentioned earlier. So that's one concrete example. I believe the applications for that first round are due today. And the plan is to have checks cut by next Tuesday for those folks who are awarded.
Great. Thank you for that. And thank you, Freddie, too, for sharing your views. Atia, have we had any success with getting some questions from our participants? I just thought I would check in with you before we continue. Or Tiffany? They're probably on a phone with a...
No, sorry, let me unmute it. Me and unmuting. So I don't have too many emails yet, but there is just some... You've talked a lot about how this public health crisis has really elevated how essential of a social support the early child care and education is, but does anyone want to talk a little bit about the relationship? Because childcare is also an essential pillar to upholding workforce and labor market. Does anyone want to talk about the relationship between being able to offer childcare and education and our economy? And what would happen if we don't establish high quality, sustainable childcare and education in our region?
I'm sorry, Joey. So I would refer to Gary's, to the Fox Park Policies Institute's report on Make Work Work. There is no way. We have seen that if early childhood folds in this crisis, that work is not an option. I got like 4 kids over here screaming my name. We're all seeing the impacts of what early childhood really does for us. And I think that after this is over, we will all be more moved to be vigilant and really lean in on folks on how to make early childhood equitable and less of a burden for families so that they can go to work.
Yeah. Joey, I see you wanted to jump in.
It was kind of the same thing, but I guess I'll try to describe sort of longer term effects. So the less access there is to high quality early childhood education, then on top of that, you'll even have these reverberating long-term effects of children who are missing out on this window during this economic downturn in really crucial soft skill development. So you have these social emotional, these soft skills that are developed more than any time between the age of 0 to 5 in your prefrontal cortex as that's forming. And then if that doesn't happen, you're a lot less likely to earn more money, to be more productive as a worker, to be able to have long-term, like, successful relationships. There are so many things that are affected by that sort of air traffic control center that's in your brain there, that it's, yes, right now we definitely need childcare to make sure that people are able to go to work, but we also want to make sure that we're not losing out on several years of crucial soft skill development for the populations that need it most.
Mm-hmm. That's so true, Joey.
So what we are seeing is that, you know, if the critical piece of getting the region's economy back up and running is providing supports for working families so that they have a place that their child can be cared for in a safe place, but that their social, emotional development and well-being is also cared for. If we cannot provide that for working parents, we are going to really struggle to get this economy moving again, because parents are not going to be able to engage in the workforce, and it is going to hold the region back. I mean, that is the immediate. In terms of long term, if we can't provide these supports for kids, then their health and well-being is not cared for by those who have training in the best practices on how to do this. Those children are going to also have trouble throughout their lifetime because they haven't been attended to from 0 to 5 to make sure that their developmental needs are being addressed and that they're feeling safe and cared for. So there's a immediate short-term economic impact. There's an impact on the parents of these kids, and there's a long-term impact on the children. So this is really a critical issue for the region to address and to look at solidly moving forward, which is why I'm so grateful to WEPOWER and to Ready by 5, because they are really thinking about what is the long-term strategy here. We need to put these paces in place now while people are like they have some time now at home to really critically think about what's wrong with these systems. Why haven't they been functioning in a way that is beneficial to most people? Right now, what we're finding is that they are beneficial to some, and that there are a lot of kids and a lot of families who are being left behind because of structural barriers that are preventing them from an equitable access to these resources. So we have just a few minutes. I want to give each of our panelists an opportunity to share some final words. I also want to say that we have been talking a lot too about COVID-19 and racial disparities, and we are going to have a panel that looks at that with a functioning chat feature next Tuesday, the 28th at 10 a.m. It will be featuring Angela Fleming Brown. She's the CEO of the Regional Health Commission. We have Jason Purnell from the Brown School's Health Equity Works and also chair of the Regional Response Team. We have Dr. Sean Joe, who is a professor at the Brown School and also directs the Homegrown STL project. And we have David Dwight, who is the lead strategist and executive director of Forward Through Ferguson. That'll be moderated by my colleague Ellicia Thurman, the associate director of the Clark Fox Policy Institute, and Cynthia Williams, who is the assistant dean for community partnerships. That is going to be a robust conversation on the health and economic disparities that are happening within Black and Brown communities as a result of COVID-19. And I highly encourage you to sign up for that webinar, the details of which can be found on the Brown Schools Facebook page. So if you go to the Facebook and you go to the Brown Schools page, you will see a posting there that has the information on how you can sign up for that.
And Gary, can I interject one moment?
Yes.
So I do want to let everyone know that we will be sending out a thank you message for your participation. It will include some of the links and the things we referenced in this conversation, as well as a link to this recorded webinar. And I just want to say that this conversation we focused on regionally, very much St. Louis City, St. Louis County in this conversation. However, if you are wanting to stay in tune to what's happening more at the state level, I just want to put a plug for Kids Win Missouri. I think maybe Craig Stevenson's a participant on this call, but they're a great way to look at what's happening statewide. And if you want to get a little bit more involved with understanding what legislation is going to, how legislation is going to impact, I think our legislators are returning next week to the Capitol, and this is on their radar in terms of more long-term supports for early childhood education and care. So just wanted to let you guys know those things.
Thank you, Atia. And can we include a link to Kids Win Missouri in that email as well? Because Craig is really doing some incredible work, and I want to make sure folks have an opportunity to engage.
Absolutely.
So in terms of final words, Gloria, do you have a few things, and then we'll just work our way across the panel?
Okay, so a shameless plug for the Power Building Academy that we're going to kick off, and it will be virtually in June. And so we're recruiting members of the community in North County and in the city as well. So Black and Latinx community members that are interested in gaining those additional skills and advocacy, and then getting those folks ready to hit the ground when we can. And so that information can be found on the WEPOWER website. That's wepowerstl.org. And then if you're not the person to be in the Power Building Academy, you may refer someone or nominate someone to join us. And then we'll also need volunteers for phone banking and other things. And so there are other ways to get involved.
Thank you. Thank you.
Thank
Joey?
you.
Sure. I guess I would just plus one what Gloria said. And then also, I think if it's all right, Atia, if you wanted to share the link to the playbook so people can kind of look at what's going on there and be able to read all the different solutions and how you can stay engaged for years with this work if you'd like to, hopefully.
Yes, and Joey,
We'll definitely do that.
Congrats on that work, because it's the process and the product are really outstanding.
Thank you.
Mm-hmm.
Congrats on releasing your report.
Oh, thanks. Thanks so much. Appreciate that.
All right, am I up next for final comments here? So I think kind of in the big picture, this crisis is obviously exacerbating a lot of the fragmentation and a lot of the breakdowns in the systems that were already there, and is something that I hope that, again, we can make sure we're cataloging these challenges that we're feeling more acutely right now, so that when we have some more time to breathe and we have some more support with caring for our own children, or back out in the world once again, that we can direct the energy towards fixing things. I think Joey mentioned if we had some of the structures in place that are referenced in the Clark-Fox report or in the playbook, we wouldn't be feeling this quite the way that we are right now. And, I think, again, it highlights right now there's kind of this dichotomy between individual thinking and more, we're all in this together. We're doing this, staying at home for the good of our broader community. And again, I think if we can maintain that mindset when we think about early childhood in the long term, we're not just doing this for our own children or our own grandchildren. We're really doing this for the good of our whole community. Hopefully we can make some real progress.
Yeah, and thank you, Katie, for all of the work that you're doing with the regional response team. I know that I'm a little more at peace knowing that folks like you and Jason are really on top of this. It's just, it's reassuring to know that. And
Thank
then Ellicia will give you the final words.
So thank you again, Gary, for having us, and to all of my colleagues for all of the work that you are doing. There are a lot of, as you said kind of earlier, invisible faces. So again, I want to encourage you all to connect with an early childhood provider. I'd also like to lift up an agency that really has done some amazing work in connecting families to providers. So if we could kind of call out Child Care Aware, they are an organization to follow. They have been mapping out what centers are open, what resources are available to centers and families. So if you know of a center and they may not have a connection, that's a great place for folks to start. And I know that Robin and her team has done a wonderful job in trying to map out how to get families of essential workers cared for. So I wanted to put that out there. And then also I would ask all of us, today on the call, if you could make yourself proximate with a community that does not look like you, and figure out what would it be like to live in these times in a way that is not, that you are not accustomed to. And for some of us, that's our reality. So you don't get to live outside the box. It's not a dream, it's our reality. And so in that, I find that when we become proximate with what is happening in these times, we become more relatable, and we become more pliable, and have the ability to use our superpowers to not save communities, but to be a part of a community that helps and heals alongside each other.
And Ellicia, you are an incredible, powerful advocate and have made some just outstanding contributions, not only in the early childhood system, but to communities and the region overall. So thank you so much for everything that you do.
Thank you, Fran.
Gary, can I just share the results of the poll real quick about who was
Sure.
here with us today?
Yeah.
All right. A lot of educators. Thank you to our educators.
Yeah.
And everyone who was on the call.
So yes, and thank you too. I want to just wish everybody good health and safety, and I hope that you'll be able to join us on Tuesday's COVID-19 and racial disparities webinar. We look forward to seeing you there. Thank you.
Thanks for having us.
Thank you. Bye, everyone.